All right, it is 12:01, so we are going to get started, and I think there will be a few more people joining us. So good afternoon and welcome. Thank you all so much for joining us for this discussion. We're really excited to talk more about grassroots recovery in Alachua County. So on this call, we have the Community Spring team, and that includes myself. I'm Lindsay Coleman. I'm the Executive Director of Community Spring. I will be participating in the presentation today. We also have Tequila McKnight. She will be presenting as well. She is one of our fellows. Max Tipping, he's our policy director, and he will also be presenting. And you'll hear from the rest of the team later on. So also on this call, we have some media. We also have some elected officials, and as Mayor Poe, I believe, pointed out in the chat, because of transparency laws, that means that they can't speak, but they are here to listen. Also, we have some people who took the survey, impacted people. This is also being recorded, so please keep that in mind, and all of this will be on the record. Also, you may have noticed that you were muted upon joining the call, and when we get to the discussion portion, we will unmute people accordingly. Let's go to the next slide. So what are we going to be talking about today? So over the course of the next hour, we're going to spend the first 20 minutes diving into our community-based survey. What did we do, and then what are the results? And then we'll be spending another 10 minutes talking about how we have translated the results of our survey into some recommendations and into how to best build a grassroots response to this crisis. Next slide. And so with that, I will turn it over to Tequila McKnight.
Thank you. The purpose of Community Spring. Community Spring is a Gainesville-based nonprofit focused on dismantling structural poverty and spurring economic mobility at a grassroots level. The twin pillars of our work are providing income and building power. We do this by hiring fellows who have been impacted by poverty to help solve the systemic problems they identify as driving poverty in their communities. Up top, I'm going to introduce Community Spring. From left to right, we have Max Tipping. He's our policy director. Nadine Johnson, Latasha Brim, Kevin Scott, myself, I'm Tequila McKnight. We're all fellows. And we have Lindsay Kalman. She's our executive director. Next slide, please. The iniquities that we were feeling before COVID got worse. We were hearing about issues from people in our networks that were not reflected in policy or relief. This is why grassroots response is key to our recovery efforts. We hope the results from this survey will be used to inform policy, philanthropy, and services, and show that the people closest to the problems are closest to the solutions. Next slide, please. The model we use to create and implement this survey is called participatory action research. Participatory action research engages participants in the research topics, question framing, and translating the results into action. The process we used was we collected information from the fellows about what was going on. We crafted these questions to the community and captured what we were hearing. We vetted those questions with professional researchers. We outreach both in our communities and through paid ads via social media. We ran those for 2 weeks. Lindsay Kalman and one of our CS fellows, Kevin Scott, they analyzed those results. People experiencing poverty have been surveyed a lot without seeing a lot of change. No one likes to feel like they're under a microscope. This survey is different because our participants know who we are, they know why we're doing it, and trust us because we're part of the community. For example, I did a Facebook Live and got over 100+ responses because I'm in the community and trusted in the community as well as Community Spring. Next slide. 243 people took the survey. but only 229 of those people were eligible participants because they were not Alachua County residents. These numbers are representing 497 people in Alachua County. We had representatives from all over Alachua County. Here we can see a heat map based on those responses. Also, we had representation in outlying areas such as Alachua, Archer, High Springs, Newberry, and Waldo. Next slide. We had a pretty even distribution of income brackets. In reporting on these results, we define low income as households making less than $50,000 per year. This is indicated in the pie chart as red and orange. Assuming a household size of 3, $50,000 per household is 80% of area median income. According to HUD, those households are considered low income. According to ALICE, which is what United Way uses to measure poverty for a household of 2 in Florida, is 44,200. Our determination of 50,000 per year per household is in between those two measurements. Next slide. We asked the question on the survey, if there was a $1 million fund for COVID-19 relief, what are the top 3 things it should be spent on? And as you can see, number 1 was rent assistance, number 2 was food, number 3 was cash to individuals. We're going to talk about each of these in depth throughout this presentation. Next slide. Impact on income. This is the most significant, compelling finding of our research. There is a direct relationship to income category and impact of COVID-19 on wages. We asked how people's income changed in April and May, and the people who reported a lower annual income bracket also reported greater loss of wages due to COVID-19, as seen in the graph. Not shown in this graph is the analysis of people who lost 100% of their wages. 26% of people making $20,000 lost all wages, while no one making $80,000 or more lost all their wages. The main conclusion is the people impacted most by financial flux are people who make less money overall. This is the meat and potatoes of this presentation. Financial resilience is key to economic well-being and the prevention of future fallouts from a crisis like COVID-19. I'm going to turn it over to Lindsay right now. She's going to give more analysis on the survey results.
Thank you so much, Tequila. Let's go to the next slide here. So I want to piggyback off of what Tequila mentioned about economic resilience, because this does feel like really at the center of what we're talking about here. So economic resilience is the ability to withstand or recover from economic shocks. And we measure economic resilience by asking how confident people feel that they could come up with $400 if an unexpected expense arose. Now, we didn't make this question up. This is a very well-vetted question that a lot of institutions and think tanks use to measure poverty and resilience. And what's really significant here is that among low-income respondents, about half of them could not come up with $400. And what this graph is really describing is the experience of never being able to get ahead, that every economic blow is a devastating one. And we see this with COVID-19, of course, but this can also be applied to any economic shock. This can be a kid getting sick. This could be a car accident. This could be home repairs. This could be a variety of things. And when we look at COVID-19, it's an economic crisis for a lot of people. And it's all of these people that fit into the category of having low economic resilience. And so as Tequila mentioned, this is key in thinking about our recovery efforts, as well as how to prevent a crisis like this in the future. Next slide. So when we look at unemployment, what we see is that 34% of the respondents reported losing their jobs or reducing their hours. And of those, 44% are not confident that they'll be able to return to the employment with the same number of hours. We'll talk about this a little bit later on, but those people, few of them actually received unemployment benefits. But I think that what falls through the cracks here are all the people, and this came out on our qualitative responses, but who falls through the cracks here are people who didn't have employment to begin with. So that's people who are looking for jobs, that's recent graduates, that's people who do any sort of contract work, freelancers. All of those people don't sort of cleanly fall into this category. And so when we look at 34% of people losing their jobs, we also need to think about all the large quantity of people who aren't captured in that number, and therefore aren't captured in some of the relief that is specifically targeted for people who have been impacted by COVID. Because if you were looking for a job before, you were hurting, and now you're really hurting because there's just less jobs out there. And so that's an important thing to know. I think the other thing that sort of came to the surface in the qualitative research is that there are a lot of people that rely on income that isn't necessarily captured in assistance packages. So anyone who counts on overtime, which is a lot of people, people who rely on their dependents' employment to pay the bills, those won't necessarily be captured in some of the COVID relief. And so that's something to just keep in mind. Go to the next slide. So we asked about bills, who wasn't able to pay their bills. And what we found is that 30% of low-income respondents were unable to pay all of their bills. And this is really important in how we think about and measure how deep in the hole people are, what bills weren't able to pay, they were able to pay. This goes back to that financial resilience question. If you don't have $400 for unexpected expenses, then when you have an economic shock, you're likely unable to pay all your bills that month. And so when we asked what bills weren't being paid, we saw utilities as number one. And I think that makes a lot of sense since GRU is deferring a lot of payments. That's not going to be, when you have limited resources, that might not be a priority. However, just because those payments are being deferred doesn't mean that they're going away. In fact, they're just compounding. And so what this really shows too is maybe you were able to make that payment, maybe you weren't, but I'm really concerned for what happens down the road when those payments get compounded. Eventually they'll need to be paid, and what happens then? We also see credit card bill, and that's a significant one because when you don't pay your credit card bill, you're now talking about debt, and that sort of compounds the issue, and so people are getting further and further into the hole. And then rent and mortgage is obviously a big one. I think that is also in part due to the fact that there's a moratorium on evictions, but we know that doesn't mean the rent's going away, it just means it's not being paid now. We'll go to the next slide. So we asked people about what kind of assistance they are getting, and at the time of the survey, 80% of respondents had received their federal stimulus check, which leaves about 20 people who hadn't. And like I mentioned before about unemployment, only 21% of the people who lost their job or had reduced hours actually received unemployment assistance. So that's pretty low. And I think what that speaks to is just how overloaded our systems were, how delayed unemployment was. And I think that's something to think about as well. We'll go to the next slide. So housing is a really important one, and it's important to remember that we collected this data at the end of June. And so what we have here is the results for May, which said that 24% of low-income respondents were unable to pay their rent in May. If they weren't able to pay it in May, they likely weren't able to pay it in June and July. And so that's something to think about when we think about our rent assistance packages, just how deep in the hole are people. And as I mentioned before, rent doesn't go away, it just gets compounded. I think that this quote that we pulled from the qualitative portion of the research is really significant because it does outline the problem that people are facing, which is maybe they prioritized rent early on, but they still don't have a job, or they were looking for a job and still can't find one, and that really the problem is yet to come. the biggest fallout is still ahead. Next slide. So internet, we asked about internet because internet's not typically considered a basic need. And I think that in a post-COVID world, it's something that we really need to be looking at. Because as our jobs move remotely, as our children's schools move remotely, and just basic communication and access to information, internet needs to be a higher priority in our community, because what we're seeing here is that 18% of low-income respondents did not have access to internet, and 20% reported not sufficient access to computers. And that's something that we need to be thinking about more strategically. Next slide. So for food, this is an interesting one because we found that 27% of low-income respondents did not consistently have enough food in April and May. So that number is staggering and alarming, given the pretty robust efforts that our community has made for food distribution. We asked why people weren't getting access to food, and the overwhelming response was not having enough money to buy food. And so I think that's really something to think about, as well as how we are more creative about getting people access to food despite the efforts that we've already made. I think that we can't lose momentum in those efforts. It's also important to know that this data was collected before the increase in SNAP benefits to families with kids on free and reduced lunch. And so this number may have changed, and that's a question that we have as well. Next slide. And with that, I will turn it back over to Tequila to talk about the remaining issues.
Education. Overall, 64% feel very or somewhat academically prepared for their children to start the new school year in the fall. But there is a serious relationship between poverty and academic preparedness, as you can see on the graph. Of the households who felt their children were not ready for the new school year, a higher portion was low-income folk. Next slide. I'm going to read this quote that came directly from the survey that someone wrote, just to let you know what people are feeling. In my opinion, the biggest hindrance was the parents and grandparents were totally unprepared for this. In most cases, it has been many years since they have had this type of work. Some of the work they have never had, the math. It was very frustrating not being able to help the kids. And so guardians and parents are unprepared or unable to tutor and supervise. And some of the reasons that they stated were special needs, language barriers, juggling jobs, and content that was out of the parent's ability. And myself, I'm a parent of 2 high school students, and I have a grandson that's in the 1st grade. And I also can agree that it was very trying and hard, trying to help them with their work, and as well as juggle, jobs and working myself. So, next slide. Well-being. 40% of the households report more tension in the household during the months of April and May than before COVID-19. 20% say more tension in the neighborhood than before COVID-19. 72% of respondents report feeling down, depressed, or hopeless. When asked, how often have you felt that there was no one you could turn to? There was a big difference along income lines, as you can see from this graph. This question can be interpreted in a lot of ways. Support network is less among low-income respondents. When everyone around you is struggling, it can be hard to find the support that you need. It can also be shameful even asking for help when you're broke. And so I'm going to turn it over to Lindsay right now to finish it up for you guys. So thank you, everyone.
Great, thank you, Tequila. So, there's a lot of implications and conclusions that we can draw from this research. And Max will go more into some of our policy recommendations, but I think at the very least, we need to really be prioritizing low-income households. Those that were least able to bear the brunt of this crisis were the ones that were hit the hardest. And that just needs to be at the front of everyone's thinking when we think about how to recover from this. It's also really important to recognize that needs are very diverse and people's lives are complicated. People slip through the cracks, and that assistance should be as flexible as possible, because what we're seeing right now is a lot of sort of individual programs attacking a lot of different things, but then there inevitably people are falling through the cracks. And so I think flexibility is key. The other thing that I just want to mention here is how important it is to bring forward historically silenced voices in order to rebuild a more equitable community. And this is what we're trying to do with this survey at a grassroots level. That's what Community Spring is trying to do in general. But it is so important to be engaging with people, asking people what their priorities are, because they know best what they need. And so the needs and the priorities should be identified by community members. I think that this quote that I pulled from the survey really captures that in a powerful way. It says, children and families are trying their best to meet each other's needs at a time when it seems that others don't understand our fears, needs, wants, and expectations. And I think that's really powerful. People don't feel like they're being listened to. And this is a time of crisis and a time that listening is so important. So with that, I'm gonna transition over to Max, and thank you all. And I look forward to hearing from you during our discussion portion.
All right, thank you. So thanks everybody for listening, and we'll just kind of go through the recommendations, and then we'll get into the discussion portion. So just to start, I think I want to explain a little bit about what we mean when we say that we want to see a grassroots recovery and how we went about composing these recommendations. So really what we're looking for is recovery efforts that are guided by the self-identified needs of folks in the community, that seeks to develop resources that match the scale of those needs that are identified, and as much as possible gets resources directly to the households in need rather than putting them through kind of intermediate institutions or anything like that. As much as possible, getting it directly to the folks who need the help. So with that in mind, again, just to revisit what I think Tequila mentioned earlier, here are the priorities that were identified for funding by our survey participants. The top three, again, across the board for both low-income, high-income folks, were rent assistance, food, and cash to individuals. And what we did is we took these and used our survey results to try to estimate the need and build proposals that would meet these kind of identified priorities of folks in the community. So the first priority for participants was rent assistance. In terms of thinking about need, there's about 27,000 low-income renters in Alachua County, and our survey showed that about half of low-income participants lost at least 25% of their income in April and May, putting them at pretty substantial risk of falling behind on the rent. That suggests that around 13,500 households in Alachua County might be in need of rent assistance. To meet that need and kind of taking all that together, we are proposing a countywide rent assistance program that would provide at least $3,000 per household just for rent. So median rent in our area is just shy of $1,000, so that's about 3 months of rent. And again, because lower income folks have been hit the hardest, we would recommend targeting this towards folks who are making 80% or below of the area median income. If you kind of run all those numbers together, that suggests that we would need about $40.5 million in rent assistance to meet the need. There's a couple of different places that we could talk about looking to get those funds. So first, the biggest and most obvious one is Alachua County Cares, which was a plan was recently approved for federal dollars, federal assistance dollars that has about $21.1 million set aside for individual assistance, and that's for both That's for rent, utilities, car payments, kind of a wide array of things, not just rent. It's kind of across the board. The other place to look would be GNV Cares, which was a program that ran in, I think, late May that was going to provide rent and utility assistance to folks living in Gainesville. And then I think the third biggest place to look is that there's a lot of conversations around state housing funds being released to localities to be able to help with different housing issues in response to COVID. But even if you were to look at all those things, the Alachua County Cares and GNV Cares, and assume that all of that money just went to rent and not other also critical needs like utilities and things like that, that still leaves a gap of about $18 million between the need that we've identified here and the funding that's available. So it's a question of finding additional funds there. And then also, I think just as important as talking about the funding is also talking about the program design. So in a situation like this, you really want to design it in a way that limits any sort of bureaucratic barriers as much as possible, both for administrators of the program and also recipients, to be able to actually get the money out the door quickly to the people who need it most. And I think that there's some lessons there that can be learned from the GNV Cares experience, which, according to a recent Gainesville Sun article, suggested that there were only about 117 households who were approved to receive assistance, which is assuming even just the maximum benefit amount. That's only 10% of the overall money available that was spent in the last 2 months. So in order to get that money out the door faster, I think there's some lessons that we could take. One would be to keep the application open and accept applications on a rolling basis. GNV Cares was only open for about a week. Also, the importance of advertising and really getting the word out in the community so that people in need know about it. Also having it be a countywide program, not just individual city programs. We ended up talking to several folks who had gotten pretty far through the application process, only to somebody caught at the very end that they technically weren't in the city limits. They were just outside of Gainesville city limits and they weren't eligible. And then finally, I think just as much as possible, again, simplifying the eligibility criteria, the application process, trying to streamline as much as possible, because there's a lot of people who need assistance, and there's already significant funds that are allocated, maybe not enough, but still significant, and it takes time and effort to get those out the door, especially when there's high barriers. So that's rent assistance. Next, I want to kind of go through food, which again was the second highest priority identified by our survey participants. Unlike rent assistance, there has been already extensive community efforts to try to meet the need by distributing groceries, by distributing meals. Unfortunately, I think our survey showed that 27% of low-income participants did not consistently have enough food in April and May, even in the middle of all these really kind of tremendous efforts on the part of the community. So if you take those numbers and you look at there's about 43,000 low-income households in Alachua County. If you assume that about a quarter of them don't have consistent food, that suggests that there's around 11,000 households in our community without enough food. And just in terms of kind of getting a sense of scale, even some of the bigger food drives, the grocery drives, are serving about 500 households a week. So if we're talking about 11,000 households, that's a much bigger need to try to meet. Our proposals to address this are based around providing more food and also potentially providing more funds for people to be able to purchase food. So on the first point there, I think a good starting point is, again, the Alachua County Cares Plan. There is $500,000 that's set aside there for future food delivery at a time when local organizations aren't able to meet the need. Given that there were already a lot of efforts in April and May to try to meet the need, it would seem that time has already arrived. And based on that, we would recommend releasing those funds immediately rather than waiting towards some kind of indeterminate time in the future. In terms of providing funds, there's a key thing to note here that I think was mentioned earlier, that the PEBT program launched in June, right after our survey results. So again, that's providing funds for food to those families who had school-age kids who no longer have access to free or reduced lunch. Since our survey, we've heard a lot of really positive things in the community about that additional assistance. And so I think given that substantial change, we would recommend further evaluation to understand what additional gaps remain in terms of getting funds to people to be able to purchase food and understand the gap that's still there. And then the final recommendation is around cash to individuals, which again was the third priority of folks who took our survey. In terms of estimating the need, again, there's around 43,000 low-income households in Alachua County. Half of our low-income participants in the survey were not confident that they could come up with $400 just to meet, some unexpected expense, a medical bill, car repair, things like that, which suggests that they have really low economic resilience and a limited ability to meet their basic needs in a trying time like this. So if we assume that, kind of taking those numbers out, that's about 21,500 households in our community who have that very low economic resilience. Our proposal would be to set aside $500,000 in Alachua County Cares to provide $500 relief payments to low-income households who have been financially harmed by COVID-19. So that's about 1,000 households initially. If successful, I think that it could be expanded to better meet the full need that we're talking about here, the 21,500 households. There's a lot of advantages to cash assistance programs. I know it's a relatively new idea, but these types of programs are really flexible and allow recipients to be able to meet a wide range of different needs. They're also really efficient for administrators. You have lower admin costs, the money gets out the door much more quickly. And then also for recipients, it allows them to keep kind of their sense of agency and their power to be able to determine what they think their priorities are. Where would that money make the most impact in their life? It would be, the most beneficial to them. There's a lot of data that this is, something that always comes up is the money spent responsibly? There's actually a ton of research on this that shows that overwhelmingly these types of cash assistance programs, recipients spend it, completely responsibly. And I think the fact of the matter is that, low-income households, when they get this type of assistance, they spend it in a way that is, most beneficial to their family in the same way that higher income folks do. And I know that comes up every time, but there's actually a lot of research out there that supports that. In terms of some examples, some of the obvious ones would be the CARES Act, which, provided $1,200 payments to households nationwide. There's also a couple of larger private ones, such as Give Directly, which is raised, I think, $167 million to make payments, $1,000 payments to SNAP recipients. Another one is Give Together Now, which has raised $100 million to make $500 payments to low-income households. And then locally, just to briefly touch on CS Direct, there's a lot of, after hearing a lot of kind of similar things that were reflected in the survey very early on in the COVID crisis, Community Spring decided to launch its own cash assistance program called CS Direct. It's modeled off Give Directly, and we provide $300 disaster relief payments directly to households in our community who receive SNAP. I won't go through kind of all the details there, but more information is available on our website at the link there. So I know, just before we get off cash assistance, I know that this, again, it's a new idea, but there are a lot of advantages to consider. There's a lot of examples that could be pulled from to kind of design something that would be a larger scale and actually be able to meet a greater portion of the need in our community. It's an efficient, it's effective way to get assistance straight to our neighbors who need it, and I think that's really what a grassroots recovery is all about. So that is our very quick summary of the recommendations. That's if you are interested in learning more, we've also pulled together a report on our results and recommendations that goes through all of this in a lot more detail. It's now available on our website at the link shown here, and I'm sure we'll also be sharing it on social media. But that's the overall presentation that we have here. So I would just thank you all, everybody who's on here for listening. Thank you all for joining onto the forum today. I hope that what you've heard so far has been informative and useful. And our contact info for Tequila and Lindsay and myself is listed here. So if you have any questions or you think this needs further conversation, please feel free to reach out to us directly at the emails there. now we're going to
actually, Max, before you transition, I just wanted to say too that I included the link in the chat box to the PDF of the report. And as Max mentioned, it's also available for download on our website, csgnv.org/COVID-19, or you can click on the link in the chat box to review the report.
Perfect. All right. So now we have a good bit of time left for kind of a more a discussion portion here. So we'll start off with some questions to you all to kind of get things started, and then in a few minutes we'll switch to hearing from you with any questions that folks have or any input that they want to share on any of this. As you've seen, everybody's on mute, so the way, if you have something to say, please either chat it and we'll raise it that way, or you can raise your hand, which you should be able to, if you click on the participants tab on Zoom, there should be a little button next to your name that, or right around there that says raise hand, and I'll just kind of go through and unmute people in order. The way it works is I'll hit unmute and it'll ask you, do you want to unmute? And you just say yes. And just a kind of a final thing, we want to be able to hear from anybody who wants to be able to share their thoughts. So if folks who are speaking could just try to keep their comments somewhat limited, maybe around a minute or so, and if we have time, we can circle back and hear more from everybody. So with that, I'm gonna stop sharing my screen. All right, now let's kick us off with the, sorry, technical things here. All right, so let's just get started. I think one of the things that was surprising in our survey, and I think one of the things we're trying to make sure that we have a good handle on is what people are experiencing and or hearing about in terms of access to food. You know, I think our survey identified a really substantial need there, but then there was also, you know, recent assistance that was made. So I think just to kick us off, wanted to hear if folks on the call here had thoughts on, you know, what it looks like, or if there's, you know, gaps that you're seeing, or what your experience is. And let me just make sure that I have everything open so that I can see if anybody raises their hand. Or if anybody chats. Let's see. Any thoughts from anybody? Want to kick us off? All right, well, maybe let's...
I think Tasha had her hand raised, but just didn't do the...
Oh, here we go. Let me unmute Tasha.
Okay, there we go.
There we go.
So, in regards to what's happening with food, what I'm hearing from a lot of people is that, you know, actually having access to food, although there are, you know, we have like, you know, a food drive practically every week, and even some during the week, people are still having a hard time actually getting to the food drives to get the food. You know, money is another thing. They have to make a choice between paying, you know, rent, saving money for rent, or, you know, purchasing food or purchasing medication. So those are some of the things that are happening. And then as well as, you know, some people have restricted diets. And so some of the food that is offered, you know, maybe that's not something that they can, you know, necessarily, you know, eat or prepare. So those are some of the things that I'm hearing in regards to the issues with food. And like east side of Gainesville being a food desert already, that's even more difficult for many of the people on that particular side of town. Even, you know, having access to a grocery store when they did get the additional EBT benefits, you know, it's you know, it's difficult for them.
Great, yeah, I think that definitely reflects, I think, a lot of the stuff that was in the survey. And, you know, I think about a third of people who had inconsistent access to food reported transportation barriers to just being able to get out to it. Okay, and I think maybe another thing to just kind of throw out there before we open it up more broadly is I don't know if anybody on the call, maybe anybody who was able to take the survey could, or just in general, can lend a little bit more context to, we talk a lot about economic resilience and what it looks like to not be able to come up with $400, in a time of crisis. And I don't know if there's anybody who might be able to shed a little bit more light of kind of like what that looks like, or provide a little bit more context of where, what that experience really is.
Hope has her hand raised.
All right, Hope has her hand raised. Unmute.
Okay, I wasn't sure if I did it correctly, sorry. I just know moving is a thing that you need money for, lots of money for, and coming up with $400, is not the easiest thing. Like if you have to move from one place to the other, getting a truck, getting, things like that, packing everything, getting boxes. Don't have friends to give you boxes. It's like it's difficult. It can be very difficult. You need money to make sure the gas is filled up when you get it back, so you don't have a huge bill, when you turn back in the U-Haul truck. And even sometimes getting people together, you need money for these things. And I know moving specifically is something that several community members, including myself, has come in contact with, and just, it's not like you have the money just to pull. If you don't have the money just to pull out of your bank, then that's just another issue that kind of pushes you down. And if you have to move, it's a hard choice to make. Should I eat less this month? Should I, what can I do? I have to go without electricity. What juggling is, it's near impossible for a situation like that. So I don't know if anyone else has, just scenarios of when $400, could have just helped you, get out of a hole or stay out of a hole.
Yeah. Let's take another minute. Does anybody else have thoughts they want to share on that before we move on? All right. Well, I see.
Sorry, there was a hand raised.
Was there?
Yes.
Yeah. Why am I not seeing it? Let's see. If you still have your hand raised, I will try to find you.
In the video.
Let's see. Who was it? Anybody?
Okay, Sylvia.
Oh, there we go. Sorry. Let me unmute you there.
Oh, Zoom.
Okay, yeah, in reference to what was just mentioned, I don't know if all of you know about United Way's 211 24/7 call number. So if somebody needs help with gas or rent assistance or whatever, mental health issues, all you have to do is tell them to call 211, and we have somebody professional that will put them in touch with somebody that can help them out with that.
That's great. Thank you for adding that context. And I see also in the chat you dropped something, some information on a prescription card. Do you want to talk about that at all?
Yeah, we've been partnered with FamilyWise for years, and it's a prescription discount card, and it's available free to the public, and is quite a bit of discount savings for residents. And I'm an example of how well it works. I used to work for Haven, and my job was eliminated last year, and so I lost all of my benefits, and I'm on blood pressure medicine, and a 3-month supply of my blood pressure medicine was $585, and I got a 30-day supply for $25. So that's how important it is, especially for those low-income families, to know about the FamilyWise discount cards, and we have them in Spanish and in English.
That's great. Yeah, thank you. That's a great resource. I think also I will say that, in terms of this, where I think of what you were kind of saying around 211 too, is in terms of rent assistance. I know that there's several nonprofits that, occasionally will be able to help with rent assistance. Based on some of the information I've seen recently though, it's really just maybe like one or maybe two places that have funds for it right now. I think a lot of places are tapped out, and I don't know if you have, I don't know, more context, or feel free to tell me I'm wrong. That's fine too.
No, we do. United Way is the lead agency for the Homeless Coalition. I believe Maddie, one of our associates, is on the call. She could probably answer that better for you, but we also have a United We Care fund as well. So I just say have them call 211 and explain what the situation is, and they'll reach out to us.
Okay. And does Maddie want to add any more context? I don't want to unmute you against your will, so no.
She may not be the same one. I didn't see her last name. So, but anyway, yeah, we have funding of, funds for housing situations depending on the circumstances. So the key thing is just having that individual contact 211 or an agency that has clients that may need support and help to call 211 as well too, or just call, United Way directly.
Okay. Yeah, that's really helpful. Thank you. All right, maybe
Patrick has a question.
Where is it? Sorry.
Patrick.
Patrick, let me get to you, sir. Right.
Okay, great. Thank you so much. Yeah, my name is Patrick Dodds. I'm the director of the local continuum of care for homeless services at United Way that Kim was discussing. And so 211 is the best route. That's sort of our central repository for all calls related to rent, utility, gas, grocery. There are agencies. Catholic Charities is a great agency that works on preventative services that provides rent assistance and utility assistance. That's local here. There's another Catholic Charities that does service out in Putnam County. And we are getting more funds in through the CARES Act and through the Emergency Solutions Grant through CARES. That's going to help with rapid rehousing and help with our shelters as far as that's concerned. And what we're hearing is the next round of funding that's going to come through is going to be focused heavily on preventative services. That's going to mirror the Alachua County CARES that we're seeing, where they're going to be providing, hopefully direct funds to individuals to help, pay back the rent, the utility, the phone bill, stuff like that. So a lot of people are not aware of the United Way's involvement as the lead agency, helping with, the COC. And though we are focused COC on homelessness and preventing homelessness, 211 is an amazing resource. We have people that are available 24 hours a day, so they can call in order to, help get pointed in the right direction in those scenarios.
That's great. And I'm not sure, maybe I should ask this question before, but do you have a sense of the scale of these in terms of is it, how many folks you're going to be able to assist, what the assistance amount is, what's the budget that we're talking about?
Yeah, so that's all being discussed right now. You know what I mean? I think that this is going through several layers, right? We're getting funds from the federal government, it's going to the state, and then it's being allotted to all the different regions. So we're actively having those conversations. And I think, what you're seeing in the results of your survey is a microcosm of what we're seeing statewide and nationwide, for that matter. I think it's very reflective. What we saw in your survey is what we're hearing as well, and what we're seeing as well, what we're anticipating is potentially going to be this wave of our population impacted by COVID. So it's happening actively, I guess, is the best way to tell you. I don't have an answer for you. We're actively having discussions.
No, that's great. And that's great to hear. I think it adds more context to maybe, if we're looking at a gap of, potentially $18 million to be able to meet that rent assistance need, that's, that could be another place that it comes through and kind of steps into the gap.
That's the hope.
Hope and Tasha had their hand raised.
All right. Let me go. to Tasha first. All right, go ahead.
Hey, yeah, you asked some of the questions that I had in regards to the number of people that would be potentially served, the budget that would it be like one lump sum of a budget that's, you know, that's directed towards this type of assistance, or is it a monthly amount that's allotted? Is it an increased amount from, you know, from the past? Because, you know, I know in the past there, you know, sometimes there are limited funds. Will the funds be dispersed amongst the different organizations that do provide, you know, the services with rent assistance, utilities, and, you know, food, all of those things? I have just lots of questions.
All right, let me unmute Patrick again so he can maybe shed a little bit more light.
Yeah, so this first wave of funds that we're getting as far as COVID's related, I think we're hoping to spend those funds on our most impacted population. The folks that are facing immediate eviction and the potential for homelessness, because we have the infrastructure, we have the agencies and providers in town that can work on getting them rapid rehousing. So, you know, like I said, actively having those discussions on.
Cool.
I think Patrick froze.
I lost Patrick.
All right.
Maybe Hope can go.
Sorry, Patrick, we lost. Do you want to finish that thought? Are you back? All right. All right. Let me go to Hope, and then we'll take maybe one more question after that, and then look to wrap up.
Yes, thank you. I just had a question for, well, Patrick, or if anyone can answer it, that's on here. People that have already been affected, people that have already been impacted and have lost income, or, you know, need resources now. If someone called today, is there anything for them, you know, now? Is there any assistance for them now, or will they have to wait until these talks are over and continue to struggle?
All right, and lost Patrick's video. Patrick, or you want to take that? We'll just stay with you.
Hey guys, sorry. Everybody got me?
Yeah.
Okay, so again, is it Hope? Again, 211 is the resource that we have in place that you can call, and based on your location, they will provide you with the contact information for a local agency that should be able to help. And yes, there are funds that are available. So the agency should be able to, you know, we are provided with annual contracts in order to provide these services to the lead agency, and then we pass through those funds to our local providers, and so they should be able to help you now, and we are getting more money, we're getting additional funds that's being provided in order to help with, you know, this. I'm sorry, it said internet connection is unstable. Am I still there with you guys?
Yeah, you're going in and out a little, but you're good.
I apologize for that. I'm not sure what it is. These funds are in addition to what our annual contracts are. So the hope is that we can bridge the gap between, you know, what we had anticipated being the need versus, you know, what has now happened and what we're seeing now.
Great.
And I hope too, I mean, if there's a way that we can, if like our report or our research can help inform some of that, what the need is, and then how to fill it, I think that could be helpful. And you know, I think Max and sort of Tasha alluded to this too, and Hope just sort of alluded to this too, that you know, the need is just greater than Catholic Charities might be equipped to handle. And I'm curious, actually, just a show of hands, how many people have called 211 before? So that's a resource that you know, is being used, but I think that some of the struggle might be that call 211, but like what happens at the end of after that call's been transferred, is just a gap in funding, really, is what we're talking about. And so love that resource exists. Hope that we can help advocate to have it be better funded so that there's less of a gap between the need.
I think Kevin might be able to speak to it. I think he might want to talk to it. Let me see, his hand is raised.
Oh, yeah, I didn't have anything about 211. I just had maybe just like a comment, I guess, on like just big picture stuff as I've been sitting here listening today, that like, you know, there's like this idea of like, this person can't pay rent. They're walking around with that stress on them. So let's give them money for rent, you know, problem solved. For this person over here is concerned about food. We fill that hole and that's like problem solved. But like oftentimes no one has the luxury of just worrying about any one of those things. So oftentimes there's one person who is consumed with stress about rent and food and utilities and cash and like my well-being, like, oh my God, I'm so stressed, I'm afraid, I'm confused, I don't know what's happening, there's misinformation, there's a lot of just like intangible burden on people. And like, so there's so many people, as we can see from the numbers, there's thousands and thousands and thousands of people that are walking around with this invisible burden, you know, and they're not like, it's not like we're over here and they're over there. It is us. It's no other than us. This is not some like separate population. This is you, this is me, this is your parents, your siblings, your children. Like there's no separation between any of us. So I don't know, I'm not sure where I'm going with this, but other than that, on my mind has been how desperately we need to share that burden with people and quickly.
That's great. I think that really does kind of help ground us a little bit, because I know for me, when I start thinking about this in terms of numbers, it just, you lose sight of what it really looks like for, you know, the individual people that we're talking about. There's a lot of people. All right, so we're just about at time. I think it probably makes sense to go ahead and start kind of wrapping up here. So again, I think, thank you guys, thank everybody on this call so much for you know, coming to this forum, to hearing you know, the presentation on, you know, the results that we were able to get from our survey. I think, you know, I hope that you found it useful in terms of, you know, when some of these new funds come down, you know, maybe it helps in terms of how we design the programs and where those, you know, resources are targeted, and, you know, what, you know, different places they could be targeted towards, whether it's rent, whether it's cash, you know, where the flexibility is and what kind of, you know, kind of creative solutions we might be able to come up with. Again,
we're happy to keep having these conversations too. And so if United Way wants access to our data set or wants us to talk to people to present this research, I mean, let us know how we can best assess. And same, you know, I see Lee Fellman's here and the mayor's here, and same with, you know, conversations that we can have with the city. We did this data, we did this survey to be used, and we want to facilitate however we can to get the information out there.
I see, just real quick, a question from Lee asking how this will be communicated to the county. So they were, because they're in charge of most of the CARES dollars that we're talking about. They were invited to this forum, and we will be following up with them in a more direct fashion, since I guess they were not able to participate. So we will certainly be reaching out to them individually to make sure that this information is communicated, and that that we can kind of integrate it into whatever their plans are. And again, you know, more information for this is on our website. We have, you know, the report. We'll be posting the slide deck and this the forum there. And yeah, I think we look forward to continuing to work with everybody here. Thank you, folks, for sharing your opinions, your experiences, and I think if we can, you know, keep this energy going, we can look forward to really building a meaningful grassroots recovery to this crisis. So thank you all. Thank you so much.
Thank you all so much.
All right. Bye.